Getting pregnant is a special time in your life. There's a lot to think about. Most babies are born healthy, but all women have a small chance of having a baby with either Down syndrome, trisomy 18, or an open neural tube defect, conditions that affect the baby's health and development. The chance of having a baby with open neural tube defect is the same for all women, 1 in 1,000. The chance of Down syndrome and trisomy 18 increases with the age of the mother. It's your choice whether you want screening for these conditions. Doing prenatal genetic screening and not doing it are both good choices. In BC, prenatal genetic screening is a combination of 2 blood samples that tells you the chance of the baby having one of these conditions. Screening results are available within 10 days after the second blood sample. Some women at increased risk and those with twins will also be offered a special ultrasound that measures the fluid space in the back of the baby's neck, called a nuchal translucency ultrasound. Most women will have a result which shows a low risk for the conditions. This is called a screen negative. It does not mean that the chance of having a baby with one of these conditions is 0. It means the chance is low. Some women will have a result which shows a higher risk for these conditions. This is called a screen positive, and more testing will be offered to give a definite answer. For a screen positive for open neural tube defect, a detailed ultrasound will be offered. For a screen positive for Down syndrome or trisomy 18, women will be offered another screening blood test called non-invasive prenatal testing, NIPT. Depending on the level of risk, an invasive diagnostic test called amniocentesis may be offered. Women also have the option of no further testing. NIPT is another screening blood test that is close to, but not 100% accurate, in detecting babies with Down syndrome or trisomy 18. NIPT results take up to 10 days. If the NIPT result is negative, then the chances of the baby having Down syndrome or trisomy 18 is extremely small and no further testing is needed. If the NIPT result is positive, there is a need for an amnio to confirm the diagnosis. Amnio is where fluid is taken from around the baby with a very fine needle. This test determines with 100% accuracy if the baby has Down syndrome or trisomy 18, with results in 2 to 3 days. Doing an amnio has a 1 in 200 chance of pregnancy loss. Instead of going through the funded screening, some women may choose to pay for NIPT because of earlier and more accurate results. It is your choice whether to have prenatal genetic screening. Doing screening or not doing it are both good choices. There are lots of things to think about when making your decision. Download our decision aid and talk to your healthcare provider to help you make your choice. The earlier you see your healthcare provider, the more options you have. Prenatal genetic screening. It's your choice. To learn more, visit our website.